Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. In this segment, we'll be speaking with Dr. Maria Ryan. She's joining us here as Vice President and Chief Clinical Officer at Colgate-Palmolive. She's going to talk about the link between oral health, heart disease, and stroke, as well as some other health complications. Welcome to Health Professional Radio, Dr. Ryan. Thank you for joining us this morning.
Thank you for inviting me to be on your program, Neil.
Well, as Vice President and Chief Clinical Officer at Colgate-Palmolive, give us a brief look into your professional background. What's your area of expertise and your role as Vice President and Chief Clinical Officer at Colgate?
Sure. So I'm actually a clinician. I'm a periodontist with a PhD who has done work over the years looking at the connections between oral health and a person's overall health and well-being. And in my position here at Colgate, I run our clinical team, which really does all of the hard work to show the importance of the products that we provide to consumers and to professionals to ensure that people have good oral health, that they have good skin health, and that their companion animals and pets through our health products have good health as well. And so we run the clinical research within the organization. We do over 200 clinical trials a year to support our claims for our products. And I also have our knowledge management team and our scientific communications team, because it's really important to communicate the science behind our products to help people to achieve good overall health.
The message that I've received, and this is just my own experience, is that it's more about aesthetics and discomfort, tooth loss when it comes to focusing on oral health. But we're talking about other health problems that one might not associate with oral health.
Yeah, absolutely, Neil. And, I think that the aesthetics is what people often focus on because, your smile is important and how your appearance is important. But we do know through years of research that many of the diseases that we treat in the oral cavity, whether they be cavities or gum disease, it's driven by bacteria and inflammation, right? Mm-hmm. And so anytime we have an infection or we have chronic inflammation, and actually the most common chronic inflammatory disease in the world is periodontal disease or gum disease, we manage it. And yet people don't look at what's happening around their teeth in the same fashion. And this is really due to low oral health literacy throughout the world. And we've actually initiated a campaign called Know Your OQ, just like people know their IQ or their EQ. What do they know about oral health? So what is your oral health quotient? And so we have a test that people can take, and they can get a score from 0 to 10 to really learn about whether or not they understand the importance of oral health and the diseases that can occur in their mouth and how to best manage them and why it's important to manage them. And it's not just about the aesthetics.
Is it because the oral cavity is so close to the brain and so close to the heart and lungs? Is that the link between oral health, heart disease, and stroke?
Well, what happens, Neil, is that, you have bacteria in your mouth that actually will cause inflammation in people who are at greater risk. And they may be at greater risk because they don't, decrease the levels. They may be smokers. They may have diabetes. There are numerous patient populations who are at greater risk, people with women with osteoporosis, etc. And so those people will develop periodontal disease or gum disease, which is the breakdown of bone and connective tissue that supports the tooth. And that's why if you don't treat it, people's teeth will become loose and they'll eventually lose them. And that's very different than gingivitis, which is the inflammation that's transient around the gums that is reversible. And when people develop this more severe form of gum disease, which often is a silent disease, so many people don't know they have it, but we know that in the United States, 50% of our population suffers from some form of periodontal disease. And if it's not treated, the bacteria in the mouth can actually get into the bloodstream. And those bacteria have been found in atherosclerotic plaques that line the blood vessels, increasing your risk for a heart attack or a stroke. And this can drive inflammation within the oral cavity and within those plaques, which is measured in the body by a protein called high sensitivity C-reactive protein. And so when you have chronic inflammation like that, it increases your risk for a heart attack or a stroke. And in fact, many physicians will measure HSCRP along with cholesterol, which we all know about. We want to lower our cholesterol levels. But the recent data says that if you have chronic inflammation, this may be an even greater risk factor for heart attacks and strokes. So if you don't treat this gum disease, those levels will be maintained at a high level. We also know that if you have this type of chronic inflammation, that it increases your risk for developing diabetes. And if you think about those bacteria getting into the bloodstream, they have been found in amniotic fluid and in fetal cord blood. So in pregnant women, where they're also at greater risk for developing gum disease because of hormonal changes, et cetera, if that is not managed, it could increase your risk for adverse pregnancy outcomes like preterm delivery, because inflammation there will really drive many of the factors that cause preterm rupture of the membranes and contractions. And so it's very important to manage oral health throughout life, because if you don't and you have these diseases like periodontal disease, it could increase your risk for a variety of other systemic conditions. And, you know, number one killer for people, for women in the United States is heart attack. And, you know, the signs are often different. So we know that we have to be very cautious, but we also know that when it comes to oral health, hormonal fluctuations during puberty and menstruation and pregnancy, as I mentioned, and in menopause, all make women more susceptible to gum disease, to periodontal disease. And these hormonal changes throughout life really require us to ensure that we have good hygiene, right? So we have to ensure that we're using preventive strategies, brushing twice a day, flossing, using mouth rinses, seeing the dentist on a regular basis, because some of these diseases, you know, don't have any real signs and symptoms until they're very far gone. And so you need to have someone make sure you don't have it. And if you are pregnant, you know, we know that half of pregnant women can develop gingivitis during their pregnancy, and it's very important that they be checked out before, because if you start with a clean mouth, you're less likely to develop it. And particularly, we're talking about heart disease. You know, women during menopause are more likely to develop osteopenia and osteoporosis, which actually can increase that protein I mentioned before, that chronic inflammatory protein in the blood called HSCRP. And it also can increase your risk for developing periodontal disease, as I mentioned before. And periodontal disease can then add on higher levels of chronic inflammation, HSCRP. So as women age, it's very important that they are looked at by physicians to ensure if they have osteopenia or osteoporosis, that that's being managed. They're seen by the dentist to ensure if they have gum disease, that that is being managed. Because if you can reduce that chronic inflammation, you can reduce their risk for a heart attack or a stroke. And the data shows that if you have untreated gum disease, your risk for a heart attack is twofold, and your risk for a stroke is threefold. So it's very important to really address oral diseases, especially as we age.
Doctor, is there a website where our listeners can learn more?
Sure. At www.knowyourOQ.com, your listeners can go and take that little quiz and see how much they actually know about all of this. And that website has lots of information on the connections that we have been talking about.
Dr. Ryan, I appreciate you joining us here on Health Professional Radio. Hopefully we'll have an opportunity to speak again.
Thank you so much, Neil. I appreciate you having me on your show.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Maria Ryan. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.